to Pacific Fertility Center's HCG intramuscular injection training. This training will show you step-by-step instructions on how to prepare and administer your HCG injection. Our goal is to make this as easy as possible for you and to ensure your success. If you have any further questions after watching this video, please do not hesitate to reach out to our staff. At the point in your cycle when it is time to administer the HCG medication, a member of the nursing staff will meet with you one-on-one to review your specific instructions. At this time, they will also be mixing your medication. Today, we will be reviewing how to draw up and administer this medication. Let's begin by identifying the components that you will be using. First off, a vial of pre-mixed HCG solution, 3 ml syringe with an 18 gauge needle, 25 gauge 1.5 inch needle, alcohol wipes, gauze, and a sharps container. It is critically important that you perform the HCG injection 36 hours prior to your scheduled retrieval time. To prepare the injection, please begin by checking the expiration date. Please make sure that you're working on a clean, hard, flat surface, and make sure that you've washed your hands with antibacterial soap. First, we will open the 3 ml syringe with the needle attached. If your 3 ml syringe does not have a needle already attached, please use either an 18 gauge or 20 gauge needle to prepare your injection. Pull the plunger down until there is 1 ml of air in the syringe. This will be when the top rubber line is at the 1. Insert the needle into the vial of HCG solution. Push the plunger down to inject the air, while also holding the plunger down, invert the vial. It is important to make sure that the tip of the needle is in the HCG vial. Then you can draw the full amount of the liquid into the syringe. There will be a tiny amount of the medication remaining in the vial that you can't withdraw. That's expected. Go ahead and untwist the needle from the syringe and place it in the sharps container. Take out the 25 gauge 1.5 inch needle from the wrapper and attach it in a twisting motion to the syringe. If there are any air bubbles, point the needle upward, forcefully tap the syringe, and gently push the plunger to remove the air bubbles. Push the plunger up until you have one small pearl at the tip of your syringe. Let's take a moment to summarize key points. Begin by laying out the supplies on a hard, clean surface. Remember to wash your hands with antibacterial soap. Pull the medication from the vial into the syringe. Change the needle. I will now show you how to administer the injection. We will demonstrate how to do self-injection or injection with another person assisting you. First, I will demonstrate self-administering the HCG injection medication. Choose either the right or left buttock. The simplest way to give a self-injection is to use the same side as your dominant hand. Clean the area with an alcohol wipe. Sit in a chair or a stool so that your torso and legs form a 90-degree angle. If you are right-handed, cross your right leg over your left. If you're left-handed, cross your left leg over your right. Hold the HCG syringe so that it almost appears that you're giving a thumbs up. Inject the needle at a 90-degree angle with a fast and firm, but not stabbing motion. Pull back the plunger slightly with your thumb to check and see if there's blood in the syringe. If you do draw back blood, withdraw the needle from your muscle, remove the used needle, put on a new needle, and start again. Then inject the HCG medication slowly. Please do not move when you inject the medication. Remove the needle quickly, and you can drop the entire syringe into the sharps container. Apply gentle pressure for 1 minute, counting 100, 2 100, etc. Place a Band-Aid over the site if necessary. And then, as always, at the end, wash your hands. The second example we're demonstrating is when someone else administers the HCG injection. It is best for the patient to be lying flat on their stomach to receive the injection. Choose a site, either the right buttock or the left buttock. Remember, the injection will be in the upper outer quadrant. Clean the site with an alcohol wipe. Inject the needle with a fast and firm, but not stabbing motion. Hold the syringe steady while you pull back slightly to check for blood. If you do draw back blood, withdraw the needle from the muscle, remove the used needle, put on a new needle, and start again. Again, inject the medication slowly, and do not move while injecting the medications. Remove the needle quickly, dispose of the entire syringe in the sharps, apply gentle pressure with a cotton ball or gauze. Hold the pressure for 1 minute. Place a Band-Aid over the site if necessary, and then wash your hands. Let's take a moment to summarize key points. It is critically important that you perform the HCG injection 36 hours prior to your scheduled retrieval time. You may administer the medication to yourself, or someone else may administer for you. Choose your site and clean with an alcohol wipe. Inject with a fast and firm, but not stabbing motion. After the injection, place the entire syringe into the sharps container. Apply gentle pressure with a cotton ball or gauze. Hold the pressure for 1 minute. Wash your hands. Congratulations! You've learned how to administer the HCG trigger medication. Now, many of our patients do ask about side effects. It is normal to experience soreness to the affected muscle, as well as some bruising. Many of our patients find it helpful to apply ice to the area to alleviate soreness. Heat may also be helpful. Thank you so much for taking the time to view this video. If you have any questions, please call or email your care team. We wish you every success.